Briggs and Martha Abbott were in a car, a year or so ago, heading to Chet Briggs and Martha Abbott were in a car about a year ago, heading for a meeting up in the Northeast Kingdom, one of the small towns. And Martha was driving, and Chet was kind of dozing in the passenger side. And suddenly Martha made a pretty hard left-hand turn, and Chet kind of half woke up. But then she accelerated, and then made an even more violent right-hand turn. And by now, Chet is wide awake. She headed down the road a little further, and then another left, and another left, and then another right. And Chet now he's on full alert. And he looks at Martha and says, "Martha, we're lost, aren't we?" And Martha said, "Well, yes, we are, but we're making good time, don't you think?" That's how I'm feeling about healthcare these days. We're lost, and we're making good time being lost. I work now, and have worked, in places that have universal coverage and versions of single payer, many versions. The Netherlands, Norway, Israel, Northern Ireland, the Republic of Ireland, Chile, and Australia. Based on what I've seen, it would seem to be a no-brainer, but it's not. And it could work here. Vermont is not like a lot of the country. Here are a couple positive things about Vermont that are actually in our favor on this issue. Our primary care docs are in this for the right reasons. They are some of the lower paid primary care docs in the country, and yet the medical ethic and their enlightenment is very high. The quality of our healthcare in Vermont is solid to begin with, but it is now under increasing pressure. Our political leaders in Vermont are generally accessible, although some of those who you might least expect have been resistant to real reform. Our efforts at access are among the best in the nation, but we're continuing to lose ground on that front, particularly in these hard economic times. Most people in Vermont seem to want a single-payer system. The polls that have been done seem to be very clear on that point. And there are also some negative trends in Vermont that are, in a way, perversely pushing us hard and helping us to get to where we need to get to. The overall cost of healthcare in Vermont is rising more quickly than in most of the rest of the country. There's a growing and more intense reaction setting in across Vermont about these costs. Our Vermont government constantly and consistently underpredicts the rise in healthcare costs. People are finally catching on to that. The backbones of our former public policy on healthcare reform are catamount health and chronic disease management. They have been adopted against all the evidence. Catamount, a subsidy program, has been tried in about 10 other states over the last 10 to 15 years. In every case, like Vermont, the number of uninsured initially declined, as it did here. But in every case, when it became clear that the states could not keep up with the rising cost, the number of uninsured today is greater than when the program started. That's true in Minnesota, true in Tennessee, true in Oregon, true in Maine. These are good examples. We can't buy our way out of this mess. If the stakes weren't so high, it would be amusing to see the Healthcare Reform Commission and even VPIRG, which is a major supporter of Catamount, being puzzled by the current reduction in enrollment. 4 years ago, in a series of newspaper op-eds, Dr. Deb and I predicted this based on the evidence. Chronic disease management is good healthcare policy, but the experts from away, on whom Vermont has mightily depended, and our Vermont policy leaders keep crowing about the potential of chronic disease management to control cost over time. This is overt fallacy and prevarication. All of the relevant literature tells us that with the exception of certain controlled populations, such as the VA or prisons, that these techniques will not control costs, even though they are good health care. Further, even if they somehow do control costs, which they won't, it will take at least a decade to see any real results. Over that time, overall healthcare costs will have again doubled and then some. Can you imagine? We can't wait. These efforts to mislead are coming home to roost. The people of Vermont are now seeing that these efforts will not and cannot work to control the overall cost and complexity of healthcare. And in fact, they are adding to cost and complexity and are costing us valuable time and energy. We have the opportunity to make a fundamental political shift of philosophy with a new governor. We have the opportunity to elect someone who understands the problem and how to deal with it. Some of the candidates look like they might fit the bill. Also, we're beginning to see some shortages in certain provider sectors, such as primary care. People won't stand for that. It's already getting tough to find a primary care doc, certainly in central Vermont, and I'm sure in the other parts of the state. And we're about to see a large proportion of them leave the service over the next 10 years. And the new federal bills, if they continue to follow the paths that they are on, they will be a great disappointment to many and anger others, and even worse, increase our costs. More about that in a moment. All of these trends and dynamics are getting people more agitated on behalf of real